Hello everyone, I'm Dr. Mohan Kumar V, consultant physician at Revive Hospital, Mysore. Today we have a very interesting case of Mrs. Mahalakshmi, who is aged around 65 years. Very interesting presentation. So I wanted to discuss about this case so that others also know about these cases, these sort of rare cases. Number one. Number two, how integrated approach can lead to dramatic recovery in these patients. So Mrs. Mahalakshmi, she is aged around 65 years. In the month of July 2025, she presented with unusual symptoms, loss of appetite, blurring of visions, eye movements, some sort of unusual symptoms there where they consulted some doctors in JSS hospital. Their interdisciplinary team approach was instituted and the physician referred to neurologists after MRI and other things. So finally diagnosed as IgG4-Related Disease. So they referred to rheumatologist in JSS hospital. So the patient was admitted 3 times in the month of July, then August, then September. In the 3 months, she was admitted for almost 10 to 15 days in the hospital. She had major symptoms of no appetite and closure of the right eye. Apart from that, blurring of vision, severe fatigue, cough, not able to sleep, epigastric discomfort, abdominal discomfort, like that, multiple issues. In such a scenario, she was admitted 3 times, and every admission, some sort of recovery. Again, patient was getting the symptoms back. She was not at all comfortable. In such a situation, patient's son's friend referred to our hospital, Revive Hospital in Mysore. Patient came to me. When the patient came, she was steroid dependent. She was not able to walk. She was not sleeping comfortably. Chronic cough was there, multiple issues. So in such a situation, she came and was admitted in our hospital. We admitted the patient, evaluated the patient thoroughly, and she had mild CRP elevated, yes, elevated ongoing infection. We identified the infection using the ID panel PCR test, and there was a Staph aureus infection with MRSA gene resistant marker identified. The patient was treated, then gradually whatever the fluid accumulation which had happened, excess fluid in the body, was removed through diuretic and dietary modification. So later completely she was weaned off steroids. Only steroid sparing therapy was instituted. Apart from that, taking care of her kidneys, overall health, including nutritional therapy, everything was instituted. Later, because of the chronic inflammatory disease like IgG4-Related Disease, which can involve the eye orbits, which can involve the pancreas, which can involve the retroperitoneum or central nervous system, multiple areas of involvement, that is IgG4-Related Disease, which is a complex inflammatory disorder. In such a case, what we did, anti-inflammatory medication and medication to support the kidney health and all other appropriate medication, appropriate nutrition, compliant steroid sparing medication, making the free come out of steroid dependency. That was the main agenda. We did that. After that, she was given ECP therapy. Post ECP therapy, patient became very comfortable. Her inflammation settled. She was able to walk comfortably. Her moon phases reduced, body weight reduced, excess fluid in the body also came down. Patient become very much all right. So what I am trying to tell you here is a chronic disease should have an integrated approach rather than multidisciplinary. Of course, multidisciplinary to make a diagnosis is very important, but holistic approach to make the patient feel better, that is very important. Now let us hear from the patient's son what was his experience in other hospital, how he came to our hospital, and what was the experience. Let us try to hear.
ಇಂಗ್ಲೀಷ್
ಕನ್ನಡ ಮಾಡಿ.
ನಮಸ್ತೆ, ಕಿಶೋರ್ ಮಹಾಲಕ್ಷ್ಮಿ ಅವರ ಮಗ. ಆ್ಯಕ್ಚುಲಿ ನಾವು ಇಲ್ಲಿ ಬಂದಿದ್ದು ಅಕ್ಟೋಬರಲ್ಲಿ, ಬಟ್ ಜುಲೈಯಿಂದ ನಮ್ಮ ಅಮ್ಮ ಸಫರ್ ಪಟ್ಟಿರೋದು ಒಂದಲ್ಲ ಎರಡು, ನಿದ್ದೆ ಇಲ್ಲದೆ ಫುಲ್ ಸಫರ್ ಪಟ್ಟಿದ್ದಾರೆ. ಬಟ್ ಅವ್ರು ಹೇಳ್ತಾ ಇದ್ದು ಡೈರೆಕ್ಟ್ ಫಿಸಿಷಿಯನಿಂದ ನ್ಯೂರಾಲಜಿಯಿಂದ ರೈಮಟಾಲಜಿ ಅವ್ರಿಗೆ ಕೊಟ್ಬಿಟ್ರು. ಅವ್ರು ಬರೀ ಸ್ಟೆರಾಯ್ಡ್ 2 ಮಂತ್ಸ್ ನೋಡಿದ್ವಿ, ಮತ್ತೆ ಅದನ್ನೇ ಕಂಟಿನ್ಯೂ ಮಾಡಿ ಅಂತಿದ್ದಾರೆ. ಮಲಗಕ್ಕಾಗ್ತಿರಲ್ಲ ಅವರಿಗೆ, ಫುಲ್ ಮಕ್ಕ ಎಲ್ಲ ಊದ್ತಾ ಇತ್ತು, ಕೈ ಕಾಲೆಲ್ಲ ಊದ್ಬಿಟ್ಟಿತ್ತು ಇವ್ರಿಗೆ. ಆಮೇಲೆ ಬೇರೆ ಅಂದ್ಬಿಟ್ಟು ಬೇರೆ ಫ್ರೆಂಡ್ ಹತ್ರ ಸಜೆಸ್ಟ್ ಮಾಡ್ಕೊಂಡು ಸರ್ ಮೋಹನ್ ಸರ್ದು ನಂಬರ್ ಕೊಟ್ಟರು, ಹೆಸರು ಕೊಟ್ಟರು. ಬನ್ನಿ ನಾನೇ ಕರ್ಕೊಂಡು ಹೋಗ್ತೀನಿ ಅಂತ ಅವ್ರನ್ನೇ ಕರ್ಕೊಂಡು ಬಂದು ಪರಿಚಯ ಮಾಡಿಸ್ಕೊಟ್ರು. ವಿತಿನ್ ಇಲ್ಲಿ ಅಡ್ಮಿಟ್ ಆಗಿದ್ದು ನಾವು ಅಕ್ಟೋಬರಲ್ಲಿ, ದಸರಾ ಟೈಮಲ್ಲಿ. ವಿತಿನ್ 1 ವೀಕ್ ಆರ್ 10 ಡೇಸ್ ಇಲ್ಲಿ ಇದ್ದಿದ್ದಷ್ಟೇ ಆ ಅಮ್ಮ ಫುಲ್ಲು ಗ್ರ್ಯಾಜುವಲ್ ನೀಟಾಗಿ ವಾಕ್ ಮಾಡ್ಕೊಂಡು ಇಲ್ಲಿಂದ ವಾಪಸ್ ಬಂದಿದ್ದು. ಆ್ಯಕ್ಚುಲಿ ಇಲ್ಲಿ ಅಡ್ಮಿಟ್ ಆಗ್ಬೇಕಾದ್ರೆ ನಾವು ಬಂದಿದ್ದು ವೀಲ್ ಚೇರಲ್ಲಿ ಬಂದಿದ್ದು ನಾವು. ಅಮ್ಮ ನಡೆಯೋಕ್ಕೂ ಆಗ್ತಿರಲಿಲ್ಲ. ಈಗ ಇಲ್ಲಿಂದ ಹೋಗ್ಬೇಕಿದ್ರೆ ನೀಟ್ ವಾಕ್ ಮಾಡ್ಕೊಂಡು ಹೋಗಿದ್ದು ನಾವು. ಇವಾಗ ಆರಾಮ್ಸೆ ಇದ್ದಾರೆ, ವಾಕ್ ಮಾಡ್ತಿದ್ದಾರೆ, ಊಟ ಎಲ್ಲ ಚೆನ್ನಾಗಿ ಸೇರ್ತಿದೆ. ಇವಾಗ ಫುಲ್ ಕಂಫರ್ಟ್ ಇದ್ದಾರೆ. ಒಂದು ಖುಷಿ. ಡಾಕ್ಟ್ರು ದೇವರಷ್ಟು ನಮಗೆ ಇದಂತೂ.
ಹೇಳಿಮ್ಮ, ನಿಮ್ಮ ಅನುಭವ ಹೇಳಿಮ್ಮ, ಏನಾಯ್ತು?
ಎಲ್ಲ ಚೆನ್ನಾಗಿ ಮಾಡ್ಕೊಟ್ಟಿದ್ದೀರಾ ಸರ್.
ಮುಂಚೆ ಏನೇನು ಆಗ್ತಾ ಇತ್ತು ಎಲ್ಲ ಇಂಪ್ರೂವ್ ಆಗಿದೆ?
ಇಂಪ್ರೂವ್ ಆಗಿದೆ ಸರ್.
ಎಷ್ಟು ತಿಂಗಳಿಗೆ ಸಫರ್ ಪಟ್ಟಿದ್ರೆ
ಇಷ್ಟು ತಿಂಗಳು ಹೊಟ್ಟಕ್ಕೆ ಎಲ್ಲ ಒಳ್ಳೆಯದು ಮಾಡಿದ್ದಾರೆ.
Okay, that was the story of Mrs. Mahalakshmi. She was aged around 65 years. How through this case scenario we can understand how integrated approach to the patient and listening to the patient owes, what are the patient's problem, talk to the patient, take the history properly, and instituting appropriate treatment. That plays a very, very important. And whenever possible, steroid sparing is very, very important, because long-standing steroid can lead to multiple complications in terms of osteoporosis, Cushingoid features, various proneness for various infection, and like that, multiple complications of long-term steroid usage. Wherever possible, we should limit the use of steroids and institute appropriate steroid sparing therapy. So this is a case where we approach the patient from a different perspective. We took care of our nutrition, took care of identified our infection. We instituted steroid sparing therapy, and of course ECP therapy played a very, very important role in bringing down the inflammation and improving the circulation to every organ of the body. That's how the patient recovered. With that story of Mrs. Mahalakshmi, I'm going to end today's episode of Interesting Cases. Thank you, everyone.